Good day, fellow healthcare professionals. Thank you for being here today as we delve into a matter that is fundamental to our work in healthcare: the ethical implications of communication in allied health research. Over the next few minutes, I aim to shed light on several key areas: the principles of ethical scientific communication, the ethical responsibilities we carry in human research, communication challenges and ethical dilemmas we may encounter during research, effective strategies to convey information to patients, families, and colleagues, and best practices for writing formal correspondence that reflect our professional ethics. Let us start with the core principles of ethical scientific communication. Clarity and accuracy must always be our priority. Every statement we make, every piece of data we present, should be free from ambiguity and distortion. This not only facilitates reproducibility of our findings, but also strengthens our credibility within the research community. Equally important are transparency and reproducibility. Openly sharing our methods and data fosters an environment of trust and enables through peer review. We must also remember the significance of audience awareness. Our communication should adapt to our listeners. When addressing fellow researchers, we may use technical jargon. However, when interacting with patients and community members, we must simplify our language and provide lay explanations. Let us transition to discussing the ethical implications tied to human research. As professionals, ensuring informed consent is our ethical obligation. Participants must receive comprehensive information about the study's purpose, procedures, potential risk, and benefits, and this must be done free from any coercive pressures. We must adhere to the principles of beneficent and non-maleficent. Our studies should seek to maximize potential benefits, such as advancements in patient care protocols, while minimizing both physical and psychological harm. Additionally, confidentiality is paramount. We must de-identify and securely store all participant data to protect their privacy. Now, let's address the ethical challenges involved in communication during research. One significant issue is unintentional deception. How the framing of questions or the use of nudges can bias consent and compromise true anonymity. It is equally crucial for us to disclose any conflicts of interest, including research funding sources or industry ties, allowing our participants and colleagues to assess our findings with objectivity. We must also be mindful of cultural and language barriers. Utilizing certified interpreters and culturally appropriate material ensures that all participants fully comprehend consent forms and study protocols. As we consider communication strategies within our practice, structured tools like SBAR, Situation, Background, Assessment, Recommendation, enable us to convey critical information effectively among team members. When interacting with patients and families, I employ the teach back method. After explaining a procedure or medication regimen, I ask them to rephrase it in their own words. This not only confirms their understanding, but it also helps to identify any misconceptions before we proceed. Throughout all interactions, it's essential that we demonstrate empathy, engage in active listening, and uphold professional boundaries. For instance, I refer medical legal inquiries to our supervising clinician and dietitian questions to our dietitian, ensuring our patients receive the expert guidance they deserve. Lastly, let's discuss best practices for formal correspondence. Whether we are drafting an IRB amendment, writing a research summary, or composing a letter to a patient, starting with a clear subject line that certainly reflects the content is key, like amendment request, addition of sleep questionnaire. I make sure to state my purpose immediately, followed by an executive summary of vital information. Utilizing headings and bullet points help to organize complex information clearly, and I adhere to proper APA citation standards. Each correspondent concludes with a respectful salutation and my contact information for follow up. This organized approach allows busy readers to grasp essential points and know where to direct their inquiries. In conclusion, ethical communication in research transcends mere compliance with regulations. In its commitment to honesty, respect, and service, reflecting values that resonate deeply with our professional identities. As articulated in Grand Canyon University's statement on the integration of faith and work, we are called to embody integrity, compassion, and servanthood in every interaction. By embracing these principles, we not only contribute to the advancement of scientific knowledge, but also honor the dignity of every individual we serve. Thank you so much for your time and attention.